today we are going to start about reflex maturation test. So basically we are going to talk about the primitive reflexes. So there are total 9 primitive reflexes, which include the primitive reflexes and the tonic reflexes. So primitive reflexes are total 6 in the number, and the tonic reflexes are total 2 or 3 in a number. The tonic reflexes are integrate at the brainstem level, and primitive reflexes integrate at the spinal center level. So first of all, 6 type of primitive reflexes. First is the flexor withdrawal reflex. To test this reflex, the patient position is supine or sitting. We give the noxious stimulus to the sole of the foot, and the response is toes goes in extension, foot goes in dorsiflexion, and the lower extremity flexes. The origination of this primitive reflexes is at a 28 weeks of gestation, and the integration is at a level of 1 to 2 months after the birth. Okay. Then the second one is the cross extension. So the testing position is supine. We give the noxious stimulus to the ball of the great toe, and the response is the not the one which we will giving the stimulus, not that extremity but the opposite extremity. The lower limb goes in flexion, adduction, and then comes in extension. So also it is also originate at the 28 weeks of gestation and integrates at the level of 1 to 2 months after the birth. Then the traction. The traction is also the primitive reflex. We grasp the forearm of the baby, and then the baby comes up in a sitting position or flexes the trunk. It also originated in a 28th week of gestation and integrates in a 2 to 5th month of the after the birth. Then the Moro's reflex, which is one of the most common reflex. We drop the baby from the arm, then the baby goes arm of the baby goes in extension, abduction, and hands open, and then the baby starts crying, and then immediately it comes in a flexion and adduction. The origination is 28 weeks of gestation, and integration is 5 to 6 months after the birth. Then the starter reflex, which is common in CP children. There is when there is so much of noise fighting going on, the baby goes in extension, abduction of the upper limb, crying is start, and it is followed by extension and abduction of the upper extremity. At the birth it originates, and in some people it is persist till the lifetime. Then the grasp, palmar grasp, and a plantar grasp. So the first one is the palmar grasp, pressure to the hand, and for the plantar, pressure to the balls of the foot. There is curling of the toes in a plantar, and fingers are closed in a palmar grasp. So the origination for palmar is at the birth, but plantar develops in 28th week of gestation. Integrate palmar 4 to 5 months after the birth, and plantar after 9 months after the birth. Thank you. For the part 2 will be coming for tonic neck reflexes.